kahit po gusto po nilang
Hindi pala na-record kanina. Okay, sorry. Sorry. Hello.
Wala po ata, Sir, si Beb.
Nawala. Wala.
Wala. Sir, pa-accept daw po, Sir, si Bebs. Sir?
Hello, yes. Oo, nawala ka.
Ayun lang po, sir. Yun lang po. Yun lang
Okay.
po. Promoting education po sana sa mga baryo, liblib na lugar na hindi po nare-reach para po ma-educate po sila. It's the system po.
It's the system. Okay. Sige. Share ko lang yung mga pinag-usapan natin kanina, no? Yung scenario kanina, di ba sabi natin is an arts and science which deals with 3P, promotion, prevention, prolonging life through organized effort, no? Yung by organized community or individual people, yung parang ganun, through organized. So, pag pinag-usapan natin ng kalusugan, pag sa hospital, anong sakit mo? Anong cause ng sakit? Yun lang tayo eh. Pero pag sinabi natin public health, no? Merong mga bagay-bagay, yung sakit pala ay maraming dahilan kung bakit. Sabi natin dito, sinisigit natin si political, si mayor, si barangay captain, no? Iba yung kanilang mga priority. Of course, yung socio-economic factor, kung nakatira sila sa Forbes Park, kung kumikita sila ng limpak-limpak, no? Kung yung mga anak nila ay isang nurse abroad, no? Na nagtatrabaho sa UAE, mga nasa abroad. So, iba rin yung situation. Maaring hindi na yung kinamatay ni Tintin ay Tintin Sakitin, hindi na TB meningitis, no? Maaring iba na sakit niya. Political, yung isang pang dahilan, yung behavior. Yung behavior is cause of cause ng problema din natin, no? The healthcare delivery system, kulang sa training si midwife, kulang sa mga gamot, no? Kulang sa mga antawag dito. Yung doktor, once a week or twice a week lang siya pumupunta doon. Yung anong tawag dito, mga human resource problem, no? And other factor, meron pa ba kayo naisip na factor? Healthcare, political, socio-economic, behavioral, ano pa ba?
Sir, spiritual siguro, sir.
Spiritual, oh. Those are the, ang tawag dito, is the optimum level of functioning. Siguro the spiritual is the, ngayon lang natin nakikita na realize is a malaking factor, no? Yung ganong aspect ng araw, parang hindi siya masyadong COVID lalo, no? We need a spiritual, we need a malaking bagay yung spiritual na
Saan po nabilong yung cultural daw?
The cultural, behavior. Yes, the cultural.
Culture.
Culture, culture, pwede. the spiritual, you can include the spiritual. The behavioral, ito yung manana habit, the Philippine, hindi na-mention nyo, yung pala, sa abroad, ganun din pala. Nalaman nyo na hypertensive, hindi nagpapa-check up. Kala natin sa Pilipinas din, ano? Walang bakuna yung mga anak ni Aling Milet, no? Sa behavioral, yung mga magulang, hindi dinadala sa health center, is a behavioral, no problem. So these are the optimum level of function in the political, cultural, spiritual, etc., etc. Maraming dahilan. Maraming dahilan. Kaya very big ang challenge for the public health. Public health, no? Pinapakailaman niya everything. Pinapakailaman niya lahat. Not pinapakailaman, but pinupuntahan niya lahat-lahat. Ang source, political, no? Pero kung if you're nagtatrabaho sa hospital ang concern lang niya ay yung sakit, the disease, kung ano yung root cause ng disease, no? Pero yung isang root cause ng disease is sa family, outside the family, political, wala nang pakialam si hospital. The public health, kayo po bilang isang public health administration, aalamin niyo yung bagay na yun. Sa political, sa socio-economic, merong kumbaga, sino sa agency, government agency na pwedeng pumasok sa bahay? Tanong. Sino sa government agency na pwedeng pumasok sa loob ng bahay?
DOH.
Social worker.
Yes, DOH. Pag police hindi
DSWD.
pwede. DSWD hindi pwede basta-basta eh. No? Ang DOH ang pwede. Department of Health. Pag may complaint na halimbawa 856 complaint, 856, the sanitation code, si DOH pwedeng pumasok agad sa bahay. Pag may complaint ng namatay, may infection, pwede siyang pumasok eh. Actually, pwedeng yung police hindi pwede, kailangan may warrant of arrest. Pero si DOH pwedeng agad-agad. Pwedeng hindi kumbaga pwedeng anahan siya. Sagutin. Kasi merong complaint na ganun. Anyway, ibig sabihin, on top of everything, ay yung health ang pinakamataas sa lahat, no? Health. Kaya sa abroad, health ay nasa ibabaw eh. Secondary ng yung the safety, kumbaga, ang tawag sa transportation, no? Ang health ang nasa ibabaw. Anyway, meron pang other naisip ko lang yung presentation. Stop sharing. Okay. Sino mauna? Yun, diniscuss ko lang yung ibig sabihin ng public health. Malaki ang role natin bilang isang public health administration. We see to it that every move kung gagawin natin ay considered ng community. Not only the individual but also the family and the community. Okay. Meron tayong labonatan ba? O may magpe-present ngayon? Yung number one. Sino ba yung number one? Yung unang-una.
Hindi ako yan.
Sino number one? Sir Noel, ikaw ba?
Ako po yung last, Doc.
8 si Noel.
7 si Doktora. Tapos,
Makikita namin yan, sir.
Okay.
Parang si JJ yata yung una.
JJ.
Si JJ ba? Ay, wala si JJ.
Number two.
Ako po yung number 2, Doc.
Game. Gerard.
Oh my
Okay naman
God.
dun.
Okay, Doc, pasensya na talaga. Ito lang yung naabot ng ano ko eh.
Sige,
So,
share screen.
yeah, good afternoon, classmates. So I'm gonna share. Actually, my topic is all about, let me just share first. Saan na ba yun?
Gerard.
Mhm. Okay. Can you see my screen?
Okay, okay.
All right. So I'm tasked to yeah, to give some topic on the preventive and community healthcare core syllabus, and specifically uh, number two is, teka lang daw what was number two? I forgot. Um, ito, provide clear direction, inspiration, and motivation to the healthcare team and community. So what actually working in the Department of Health, I what comes what quickly comes to my mind is on how to promote um, the health education, or shall I say, um, health promotion and population health. So actually, that is the first topic, or that will be uh, the topic that I will include it in the core syllabus in case if it is approved. So where well prior to the, if we start with this topic, I also put it here, the definition of terms. What are the um, common words or common terminologies that students will encounter as they study this subject or this course, or yeah, part of the course. So we have health promotion, what is community, what is epidemiology. Since I also linked as to you cannot promote health to the population or to the community if they are not aware of the uh, the the sources of such illnesses, or saan galing ang mga, like for example, if there's an outbreak or something like that. So it is very important, and also the illness, the types of illnesses, and I also include the concepts of health, motivation and inspiration. I'm actually I want to focus more on the IEC, or the information, education, and communication materials, where I believe that it is one of the most important tool in public health that can help our constituents or our community be educated on what are the different kinds of programs and what are the different kinds of diseases, reportable diseases that will encounter in such community. And thus, if the student will be able to know, then he or she, in the long run, can also promote, uh, giving of such IEC materials for the community. And I also put here health education, risk communication. I put risk communication here because now, since we are on the hype of our COVID-19 vaccination, and it is not impossible that there are no adverse event following immunization, then as we all know, if these events will not be uh, supported, or will not be, what do we call this one, will not be prevented from uh, what do we call this one, from the public, uh, because adverse event is negative to the community. Now if this will not be prevented from spreading to the community, then our program will be hampered with such negative remarks. That's why I put how important, or the student must study how to do risk communication in such a way that they can prevent and protect the integrity of the program. Of course, the lifestyle, what is healthy population, and what is target population. Because when you do such IEC materials, number one objective there is who are your targets. So later on, as we proceed, I will let you see some of the IEC that I made in the Department of Health. So here for the aims, so to focus on the assessment and management of healthy population. So there are, when you say assessment, there may be some tools such as checklists for us to be guided on what are the good points and the bad points, no, in this in this community, and in such a way we can also gather that data, and from that data we can create, or we can make some actions or solutions if ever there are problems, or there are a lot of problems compared to good practices by using those checklists, or by using the checklist. Also, my aim for this is that the students will know the concepts of health, health promotion, and illness prevention to have a healthy population. So these, as Sir Hendricks mentioned earlier, that the three P's: prevention, promotion, and what was it again? Prevention,
Prolonging life.
and promoting life.
Prolonging life.
Prolonging life. Yeah, prolonging life.
Prolonging.
So these are three vital P's in order for us to say that this community or population is considered healthy. So by studying this course, the student may somehow learn on how to or may learn on what are these concepts, or what are the background or the backbone of this one. Next, I also put here that the students will know more about health promotion, motivation, and inspiration in achieving a well-planned action as a healthy community. Now, I relate this one to what is really happening as of the moment, and I'm sure that this is just the beginning of such health crisis, no, or emergency crisis. So this is actually an eye opener to us, that it is now the best time to boost our health system and help them, or help our community in promoting and in motivating in some way, because it's not just if you classmates, if you can remember the determinants of health that I've discussed when during our previous subjects, that there it's not just it's not because of they lack financial, or they're financially incapacitated, but they cannot be, or they cannot attain good health. However, if the person is well motivated on how to turn this around in a negative way, or in a bad way, instead of to turn this into a positive instead of bad, then this individual can what influence the other community members to, like for example, to create more activities in their community to prevent, or to achieve a uh wellness in their community, like for example exercises, or like they can plan some other activities. And also here I put yeah, to know more about, or to know more how to make this instructional materials, and to be able to understand the importance of risk communication. So as I've said earlier, that the risk communication is very much important in public health, because if we cannot prevent it, or if we don't know how to do risk communication, then of course the program that our government is implementing will be at stake. Now, what are my strategies here? So the strategies that I so yeah, so the strategies, so the objectives be met through individual study using the resources given. So there are if hopefully we can provide a lot of resources, then it will be better, and the student will be able to uh, study on his or her own. And active involvement in classroom activities. So since we don't have the face-to-face yet, but I just include it here because sooner or later, eventually face-to-face classes will be allowed. So especially to the higher education institution. So Also here, formal and informal exchanges, that just what we had, and series of online meetings or webinars that is actually common these days. Audiovisual aids, assignments and tasks listed, and also yeah, students are also advised to work resourcefully for their learning needs, just the same with individual learning. So the for my assessment on this one, so exercises are not exempted. So there should be an exercises given to the students. There should be article reviews or journal reviews if applicable, and of course, the submission of IEC materials. So yeah, I guess that's
Okay.
yeah. Yun po. So let me just share you uh, my IEC. So here, example of this one, as you can see for the measles rubella. So these are very important, especially in the community. And the recent one that I made is this one, the AFI surveillance. So actually, my target for this one is for the surveillance officers on how they report, the process of reporting, the active surveillance, because um, they are uh, influenced on the thought that these adverse events are just normal, the same as with the routine vaccines. But since these are vaccines that we are having are new, so it should be reported even though these are common to those uh, routine vaccines that we have already. So in such a way that our health co-health practitioners will be able to know, and at the same time the community will know also. It's just that my target for this one are professionals, so I did not translate it into vernacular, but it would be better if like if you target the to the community itself, then we should not, or we refrain using English uh, words, because uh, it we cannot say that all of them will understand, but it will be better that majority of the people in the community will be able to understand on what is your material talk is talking about. So that would be all, Doc Hendricks, and back to you po.
Okay, Gerard, congratulations with yung apat na strategy. Pakita mo ulit. Strategy, yung yeah, the topic aims nila ba pala? Schedules, topic aims, strategy and assessment. Maganda yung yung combination. Very applicable for the outcomes based learning. Kaya lang iba lang yung yung pangalan nito, pero the same din yung tinutumbok. Tamang-tama. Ito, remind ko ng other student, yung topic niya pwedeng mag-duplicate if ever na pwede yung isama sa topic nyo yung minention niya. Very intensive. Kasi sinabi niya, he mentioned, to be able to deliver something, dapat merong equip, tama, no? Maging equip ang isang student nitong mga bagay na to. Tama, di ba? Dapat meron kang ganito, yung kumpleto na ganito. Ang concern ko dito, Gerard, is simula nung dati matagal na ako nag-work ako before sa DOH. Still, ganun pa rin yung approach. Na-mention mo sa strategy mo, use the webinar. Pero, kasi ang pinaka-problem natin, alam ko nanonood naman kayo sa mga Facebook, nakikita niyo sa Facebook, how the blogger, no, mga strategy nila, may mga ilang million view, no? Yung DOH on delivering of this, of course, because the pandemic kasi, pupunta na rin na kasi kinakailangan, no? Nag-hit din ang Department of Health. Pero, Gerard, i-include mo ba how to create webinar, how to para maging isang 1 million view, yung mga ganung strategy. Kasi ganun na yun sa sa MBA, no? Parang social media marketing. Parang dapat maging part siya ng social media marketing because equip ka na, ang how to deliver this thing na lang. Yun yung parang dapat nating malaman din. Side note, paano ba sino ba kilala na vlogger? Paano ba si Willie Ong na naging maraming viewers sa YouTube? Para ganon. Sustainable kasi siya eh. Parang ganon. Ano ba yung mga dapat tandaan? Para maging
Siguro
Oo.
Doc,
Yun
yung sa mga vloggers kasi natin, they have their content kasi.
yung content,
that is parang pangmasa. So,
Oo.
siguro the challenge here for this siguro for this course, dapat talaga yung
dagdagan mo na lang ng ganun, no? Yun sa mga point. Kasi may mga social media marketing. Siguro samahan natin ng ganun na top. How to, paano ba, halimbawa, bakit naging 1 million views si Ong? Because of consistency. May content. DOH ba may content? Yes, a lot of content sila. Pero bakit hindi ganun kadami? Kasi because of the strategy, baka kulang pa. Siguro yung mga point na ganon, i-ano mo na lang, side note na lang, paano gawin. Parang nagturo ako dati sa hindi pa uso webinar eh. Nagturo ako sa seminar. Baguhin natin yung seminar, webinar gawin natin. Ngayon naging patok na yung webinar. Parang nag-text sa akin yung mga student, oh sir, ngayon na po yung uso yung dinidiscuss nyo, sir.
Yeah.
Oo.
Actually, we actually in here in Region 10, we do have a series of webinars, especially in PIDS-R. You know, the one of the reportable or one of the bulk sa RESDRU natin, yung reportable or notifiable diseases. So we actually had series of trainings. So since webinar is very traditional already, so it really needs someone to help you out. Because, like for example, Teki kasi yung kaibigan ko. So what he did was he make a animation, parang ganon. So he made his own games using parang ganon tools.
Part ng ganon.
Oo, parang ganon. So, but however, I am not really techie, so I think I need a lot of hands here.
Pero sa techie, actually, hindi naman gaano yung sa techie on the yung mga bago ngayon, yung collaboration.
Yeah, yung
collab with the sikat na vlogger. Yung mga ganung bagay. Merong ay siguro another topic we will discuss on the social media marketing. Anyway, magandang part siya bilang isang public health administration. Meron kang ganong knowledge on that. Yun. Okay. Next. Thank you. Isang matinding bagsak para kay Sir Gerard. Clap your hand. Virtual clap. Nasaan na ba yan? Okay. Next. Sino yung next?
Doc, ako po, si Beverly po.
Bebs, okay. Go ahead.
Doc, nasa work po ako. Humingi lang po akong 15 minutes break po.
Huwag ka muna. Sige, next muna.
Okay lang po, Doc. Kaso nga lang po, medyo... Tsaka, Doc, nakakaya kay Sir Gerald kasi yung presentation po niya is very perfect.
Given naman talaga kasi taga-DOH siya, di ba?
Tsaka, Doc, mali ata yung pagkakaintindi ko dun sa instruction niyo. So, based po din
okay
sa...
lang.
Thank you, Doc. I'll be presenting now, Doc.
Okay lang. Walang maling sa masters, walang maling sagot. Walang tamang sagot. Walang maling. Okay lang yan.
Wait lang po, Dok, naka-ano lang po.
15 minutes pa ba? Hintayin namin.
Hindi, Dok. Saglit lang. Wait lang po. Ulo. Dok, nag-error po. Unsupported po yung file ko. Wait lang po. Try ko po ulit.
Okay. Tatawag muna ako ng isa muna. Share screen. Next na lang muna. Webs, next na lang.
Sige po, Doc. Sorry po.
Sige, next. Sino yung susunod? Josephine, ikaw ba? Yung next? Sino ba yung next?
Sir, pwede naman po ako maging next. Kaya lang po, number 6 po ako.
Number 6.
Apo.
Sino
Doc,
po?
ako po yung next.
Sige, go. Go ahead.
And Doc, pwedeng
Nina.
after this, aalis po kasi magpapa-PCR
sige.
kami.
Sige, okay lang. Sige.
Nag-positive kasi
Sige,
yung
sige.
COVID ko eh. So,
Positive ka?
yung kasama namin sa work nag-positive. So, kailangan namin magpa-PCR bago makapasok bukas. Ayun po. I-share screen ko lang po, Doc.
Share screen.
Okay na po, Doc?
Okay. Ilang page to?
Onti lang, Doc.
Mga onti.
Less than
Mga ilan?
10.
Less than 10. Okay.
Opo. So, yung binigay niyo po sa akin na what it's interprofessional collaboration. So, I just added the transforming public health through teamwork because, yeah. So, my topic, again, it's interprofessionalism. And what I prepared, my course outline or the syllabus, it is consisting of 6 main topics, which the first one will be introducing core interprofessional concept, understanding roles, responsibilities, and abilities of different professions. 3, it's understanding communication, accountability, and task distribution, conflict management and negotiation. The 5th one is leadership and membership. 6 is partnership and collaboration in public health. So in the main topic for introducing core interprofessional concepts, the aim of this will be defining interprofessional education and interprofessional collaborative practice, discuss the benefits of interprofessional collaborative practice, including the impact on quality and safety of patient care, compare and contrast different forms of interprofessional collaboration, discuss factors that influence interprofessional collaboration, describe key elements of effective interprofessional team-based care, identify barriers to interprofessional collaborative practice. Next topic, ang aim niya is describe the roles, responsibilities, and abilities of various healthcare professions involved in collaborative work, including their training and scope of practice.
Okay,
Describe
next
one-
next po.
Okay po. So
Next.
yung
Sige.
third
Okay.
topic po, the aim of that is describing the importance of communication for effective collaboration. Essential elements of effective communication demonstrate the use of strategies and tools that facilitate effective communication and collaboration. Identify ways to distribute and follow up on tasks among interprofessional healthcare providers. Next topic, the aim is to describe the sources of conflict in healthcare setting. Describe two main types of conflict and how they are interrelated, as well as the impact in the team functioning. Third is compare and contrast different styles of managing conflict.
Okay,
Describe
next tayo. Next po.
For leadership and membership, the aim is define clinical leadership, discuss leadership functions that facilitate team-based healthcare, describe the concept, importance of psychological safety and leader inclusiveness, define team membership styles and their impact, demonstrate use of strategies and tools for effective healthcare team leadership and membership. The last topic, the aim is to discuss the importance of interprofessional collaboration in public health practice, to identify different models or frameworks to build community partnership and interprofessional collaborations in addressing public health needs, and apply the components of various models in creating and sustaining community partnership public health prevention initiatives. So, kakadagdag ko lang na to, it's the assessment method that I will for this topic, I selected actually lecture, team report, readings, class activities.
Okay.
Yun lang po.
Okay, Mina, please include also for example sa public health, yung mga some interprofessional collaboration, like for example in health center or in Department of Health, regional level, national level. Paano? Parang give example kung paano sila magka-collaborate. Like for example, ito yung COVID. For example, the COVID,
Sir, how about, kasi hindi ko alam yung system dyan sa Philippines. So, can I use UAE instead?
Oo, tapos paano siya, yes, is example ng UAE, tapos paano natin i-adapt sa Pilipinas or the existing, tanong ka na lang kay, coordinate ka kay the DOH people. Sino ba pwede? Si Gerard siguro, pwede kang tulungan. Paano? For example, the CESU. Paano ba yung reporting? Paano nagko-collaborate from local government to other local government? Parang ganun. Paano nire-report siya sa national? Yung parang ganun, interprofessional collaboration. How is it? Example siguro. Kasi yung basic theory, paano natin may apply sa in practice, Sige, yun lang. Pa-add natin.
So parang dadagdag siya dun sa last topic, which is partnership and collaboration, right now?
Hindi partnership yung existing. Not partnership. Yung existing. Pwedeng referral system. Very important yung interprofessional collaboration Dito nagkaaway-away, di ba? Miscommunication. Nagiging result nito
Tama.
Doc, excuse me po. Parang part po ng report kayo.
Actually, Doc, ang intindi ko kasi dun sa topic ko, kasi meron kasing dalawa yun yung 4, yung sa akin, saka yung network with relevant partners, which is yung partners yung kay, I think kay Miss,
Okay yun, ma'am.
Ito example nito, good example nangyayari ito sa Makati Med with pinag-meet ko ang nurses tsaka RadTech. Kasi normally si nurses ang frontliner, si RadTech kasi naandun lang sila sa machine,
So,
umaharap sa mga pasyente. Tapos hindi alam ni nurses yung mga dapat sabihin, for example, doon sa pasyente. For example, yung x-ray, naku, masama yung x-ray na palaging ini-x-ray, parang ganun. Pero sabi ni Ratek, hindi na masama yung palaging ini-x-ray dahil sa meron namang ano yan. Kumbaga parang pag sumobra ka sa coke, ano daw, masama yung coke. Pero kung isa, dalawa, okay lang siya. Parang ganun yung in-explain ni Radtek eh. So,
para pong, sorry po, Doc. So yung sa akin po, Doc, interprofessional within the facility, like the physician, nurses, allied health.
Pwede sa
admin,
sa
how they
public
work.
health Sa public health
Yes,
Hindi
Doc. So
not the hospital
Yes, for example, we have like primary healthcare setting because usually that's the one who, so from the main head office, how it flows through the director of that health unit. Primary healthcare, I think Philippines as a
Within
setting of Philippines, it's rural health. So from head office then to the rural health and how it flows from the rural health to the giving and supporting preventive medicine and primary care to the population, right, Doc? And yung number 6, Docs, will be the collaboration with the partners or stakeholders like from different entities, right?
Okay.
Yun nga
Sige.
po sa akin.
Oo. Kay Josephine yun. Tama.
Opo, Doc, yung sinama ko po kasi yung referral system sa Pilipinas.
Okay. That's good. Hindi mo na sa'yo yun kay Josephine lang yan. Okay.
Thank you, Doc. So, i-update ko na lang po with regards to that.
Sige. Bigyan mo ng examples sa standard nyo and the Philippine standard. Mag-research ka na lang sa Philippine standard. Okay, next po. Thank you. Isang palakpak. Nalimutan natin magpalakpak.
Thank you po.
Kay Bebs.
Miss Mina po. Hindi mo tapos si Miss Beverly.
Hindi ako nakapagpalakpak kay Bebs eh.
Pero hindi nakapag-report
Hindi
si
pa
Beth.
nakapag-report si Ma'am Bebs po.
Hindi pa ba? Sino ba nag-report na?
Si Faye.
Faye po. Faye Mina po.
Okay. Next po. Next topic. Si Bebs na tayo.
Doc, unsupported po kasi yung format yung file ko.
Ayaw. Sige. Sige.
Thank you.
Okay, next kay Miss Mina. Sino next? Ikaw na, Miss Ramirez? O tatawag pa tayo iba? Okay. Good
Doc,
luck
iba
sa'yo.
po. Thank you.
Isa muna.
Yes, po.
Okay, sige. Kay John Lloyd? Si John Lloyd tayo.
Michelle, Doc. Sorry, hindi ko pa napalitan pala yung pangalan ko.
Palitan mo. Palitan mo kasi.
Sorry.
Nag-grade ako eh.
Sorry. Okay. Sige, mamaya na lang, Doc.
Okay.
Ano ba palitan?
Sa participant.
Ayun.
More. Michelle, yan. Michelle. Bungkawil. Okay. Go ahead.
Okay. So sorry Doc, hindi ko alam kung tama yung inadapt ko kasi yung system
Share screen.
approach.
Share
Sorry.
screen tayo.
Share. File. Ay.
Ako lang pala naggumawa ng ano. Meron ba kayong background? Diba Harry Potter tayo?
Wala akong green screen.
Okay lang eh.
Doc, unsupported, i-convert ko pa daw sa PDF. Sorry,
Sige.
kasi Microsoft Word siya. Word lang siya.
Hindi sa share screen lang yan. Share screen.
Opo. Na cellphone po gamit ko.
Cellphone ang gamit mo. Next na lang. Josephine, pwedeng ikaw?
Yes, sir. Pwede naman
Okay,
po.
sige. Go ahead.
Ano ba? Wait lang po, sir. Ano ba mag-share screen? Ayun.
Cellphone din gamit
Sir,
mo.
opo, cellphone din po. So, ito po yung report ko, Network with Relevant Partners in Solving General Health Problems. So, like they said, two heads are better
Wait.
than
Network
with
relevant.
relevant partners in solving general health problems. So, collaboration allows us to know more than what we are capable of to know by ourselves, sabi nga ni Paul Solares. So, ang course description ko po, this course aims to introduce various collaborations in Department of Health in achieving optimum public health. So, nag-focus na lang po sa DOH. So, objectives, as a result of this course, you will be able to first develop understanding of the concept of intersectorality as a collaborative approach in preservation of the public health through consideration of health-related impacts of policies, programs, and projects of other sectors. Secondly, identify other interagency bodies involved in public health concerns. Third, possess knowledge about HRHN, Human Resource for Health Network, and what are its priority projects.
Ito interagency body, ito ba yung papatak ang pinaka-head is the mayor?
Doc, ano po yan? Yung mga ibang non-NGOs or
Non-government.
po. Pabanggitin ko din po
Okay.
yung NGOs. Di bali po yung sa mga mayor or sa mga Department of Health, papatak po siya sa pang-apat sa obtain awareness of the referral system and service delivery in Philippine healthcare po.
Okay.
So, ito pong mga
Yung setup
report
mismo, no?
Opo, yung setup po mismo. So, babanggitin ko lang din po yung multi-organizational body ng Department of Health na binuo nila para po masupplyan yung needs ng mga healthcare system natin. So, parang siya yung pinaka-HR ng DOH. So, babanggitin ko na din po yun. So, ang mga reference ko po is DOH, Philippine Health Systems Review, Volume number 6, and yung Universal Healthcare in the Philippines Through the Lens of Workforce 2030 po. Omnibus Review of Human Resource for Health Policies.
All right.
Thank you po.
Thank you. Game. Ready ka na, Bebs?
Yes, no. I'll try to share now po.
Share screen.
Nakikita na po.
Evidence-based. Sige, evidence-based.
Medyo nawin lang ako, Doc. Sorry. Okay, Doc, I will be, hindi ko po alam, Doc, kung tama po yung nagawa ko kasi it is course outline po. So, ang topic ko po is engaging in research research engagement po. So, yung magiging topic ko po is evidence-based public health. Meron po akong learning outcomes, which is to formulate questions to be answered, search the literature for best evidence, critically appraise for validity and relevance, plan the evidence, evaluate the effectiveness. So yung course outline ko po is first we have the introduction to define the public health, importance of evidence-based public health in public health protection. I have also evidence-based public health or EBPH and evidence-based medicine. We need to know its definition, their similarities and differences. Also, I included the factors which can impact on public health. Here po, we will be discussing about the determinants of health. Next is the problem identification in public health, wherein assessment of the reason of problems in public health. We'll be using also analytical methods in public health. We will be discussing also assessment of community needs in healthcare, wherein we will be understanding the importance of community by collecting the data to assess the importance of aspects of community needs. Another is we will be discussing the EBP framework. In this framework, we will be identifying the patient, problem, or population. We will be knowing their interventions, their comparison or control, and eventually outcome. Also, in this course, I included the basic principles of evaluation of public health program, wherein we will know the evolution of the tenets of evidence-based public health, which includes the making decisions using the best available peer-reviewed evidence, using both quantitative and qualitative researches. Another is using the data and information system systematically, applying program planning frameworks, engaging the community in assessment and decision making, conducting sound evaluation, and disseminating what is learned to the key stakeholders and decision makers. Also, after that, we will be doing the question formulation, evidence-based public health, wherein it required literature research and systematization. Also, actions to be done in evidence-based public health. We will be discussing the measurements of intervention and its priorities. We will be also I included also the systematic literature review of this course, its application to the evidence, and then emerging issues in evidence-based public health. Yun na po. These are my references po. Thank you. Okay na po, Doc.
Sorry, nagsasalita ako. Hindi pala ako narinig. Beverly, at the end, ano gusto nating malaman natin sa anong gusto natin
I-aim po?
I-aim dun sa isang masteral student? Anong gusto natin? At the end, ang gusto natin sa kanila ay maging
Yun po, decision making po, para po hindi masyadong complicated po yung process po.
Decision making?
Decision making.
Evidence-based ano ang maitutulong niya sa isang public health administrator?
Yung pong pagko-collect po ng data po.
Pagko-collect ng mga study and also sa decision making on the project program ng gagawin ng isang
public health.
Public health. Kasi minsan nakasalalay sa atin or nakasalalay sa inyo ang decision ng isang mayor, di ba? Kayo yung hiningan ng mga datos. So tuturuan sila itong mga datos pa to na nakukuha ay hindi predatory journal, hindi to basta kinukuha saan-saan lang. Ito ay galing sa matinong study, something like that, Alright, sige.
Yes.
Next pa. Okay. Web, sini-encourage ba natin ng mga public health na mag-submit ng kanilang mga researches or gumawa sila ng mga research? Kasama rin ba dito?
Hindi ko po siya na-idagdag po doon po sa strategy, which opo, doon po sana. Yun po. Encouraging po yung mga students po or postgrad students po to do a research.
Kasi ang public health dapat ang dami-daming
Wait, sorry po.
data. Ang daming data pero walang nagkakandak ng mga study. Di ba? Alright, sige. Next po. Si Michelle.
Doc, sorry po. Sorry po.
Hello? Sino pa ba? Hindi yan. Michelle, ikaw ba? Kawil?
Yes, Doc. Try ko lang ulit i-share.
Ready ka na?
Try ko lang po i-share. Kinonvert
Sige.
ko po siya sa PowerPoint.
Sige, share screen.
Doc, nag-unsupported pa rin. Paano ba? Bakit
Unsupported.
Word po siya dati. Tapos, kinonvert ko siya sa PowerPoint.
Hindi ma'am, convert mo siya sa PPT. Ay, PDF.
Ano na lang, screenshot mo na lang. Screenshot mo para punta sa gallery. Yung bawat page. Ilang page ba yan?
2 lang naman, Doc.
Ayan, screenshot mo na lang para mabilis.
Sorry.
Screenshot.
Doc, papas muna sandali. Ayusin ko lang para hindi naman masyadong waiting.
Sige. Okay. Okay, sige. Next, Doktora. Ikaw na. Dr. Amy, it's your turn. Dr. Amy, nakamute. Nakamute po kayo. Si Ma'am Justine. Sir Justine. Okay. Sir Justine, go ahead. Purissima. Wala. Noel. Sir Noel.
Yes, Doc.
Go ahead, ikaw na po.
Sandali na po. Try ko kung paano gamitin tong share screen.
Share screen na.
Doc, paano po yun? Nakikita po yung ano ko?
Yung screen mo, screen broadcast na.
Okay,
Yan, share screen.
Tapos Doc, paano po
Yan.
mapupunta sa ano ko? Nakikita po niyan?
Yes, yung practice and principles of social accountability.
Okay po. So may topic po, sir. Good afternoon po pala. My topic is practice the principles of social accountability. This is to adhere to the principles of relevance, equity, quality, and cost effectiveness in the delivery of healthcare to patients, family, and communities. So ito po yung basic orientation course on social accountability. Students should learn the social accountability school basic orientation course. This introduces the general concepts and basic elements of social accountability to both newbie and experienced practitioners. Social accountability, ang aim po niya is to, aim is to define and use correctly each of the keywords, describe what is meant by personal and social accountability, explain how social accountability principles can be implemented in healthcare delivery, explain the importance of social responsibility to communities and wider society, application of social accountability to healthcare. Next, the ethics for professionals in healthcare. This aims to provide, or it provides a relatively efficient introduction to the processes, content, and methods involved in the field of medical ethics. Next po is relevance principle. This should, define and use correctly each of the keywords, describe relevance principle, explain how relevance principle can be implemented in healthcare delivery, explain the importance of relevance principle to communities and wider society, application of relevance principle to healthcare. Next, we have health service management. This gives knowledge and skills needed to create ethical and just health care access, delivery, and outcomes within racially and culturally diverse population. Next, we have equity. We have to define
yung dinidiscuss mo from basic orientation course, social accountability, ethics, healthcare, relevance,
Yes,
and
po.
principle. Through equity, ano ang importante nito? Bakit kinakailangan ma-equip or bakit kinakailangan matutunan ng isang estudyante itong mga bagay na to?
Kasi po, Doc, yung collaboration po ng bawat isang area, specific area of parang ganun po, para meron silang experience, ma-experience nila yung paano maggawa ng ganito, ng ganyan, ng policies and so on and so on. Parang so they can learn from ano po. Am I talking sense ba?
Hindi
Parang
sa'yo,
nawala
para gumawa ng mga policy?
Hindi,
yung tanong ko, ganito yung tanong ko kasi you talk about the basic, the accountability, ethics, and the relevance principle, equity. Ito ituturo mo sa lahat ng estudyanteng naandito eh. Ikaw yung magdi-discuss. Ngayon, pag na-discuss nito, ano ngayon kung malaman namin, ano bang makukuha namin dyan? Pag natutunan namin to, or pag natutunan nila to, ano magiging sila at the end?
At the end po, they will become a successful professional sa public health. At the same time, yung paano sila mag-ano sa community.
Halimbawa sa ethics tayo, sa ethics.
Yes
for
po.
professional. Pag tinuro yung ethics na yun, ano yung matututunan nila dito?
Tamang behavior po sa community po natin.
Okay. Yung mga sinasabi mong ganun, very specific. Dapat yung mga samples or the topic should be very specific on the national setting, di ba? International setting. Very specific na magiging hindi bookish kundi applicability. Kasi ang gusto natin dito, Noel, at the end kami or kung sino man nandito, pag nagsasalita ka ng ganyan, matututunan namin yan, mai-apply namin sa susunod na mai-apply namin sa aming mga trabaho bilang isang public health administrator. Parang ganun ang aim natin. So, not only very bookish siya, but also applicability. Yung ganun palagi tayo. Alright. Okay na tayo dyan. Meron pa ba? May next page pa ba yan?
Hanggang 11 po. So ang activities, learning activities po or ang pwedeng isama natin dito is yung mag-work po tayo sa community and also with the stakeholders. So we can, kumbaga, social engagement po.
Paano yun? Paano nating, activity mo, strategy mo? Kasi kung dapat may experience, sabi mo, pupunta tayo sa community, paano yung mga naandito na hindi applicable na mag face-to-face? Anong strategy mo?
After po ng Doc, like yung present po ba na situation, current situation ang inaano natin? Or
yes.
It could,
diba?
Oo. So,
halimbawa ganito, diniscuss mo na ito, yung lahat na itong topic na yan, yung pag-discuss mo ng topic, meron kang sinabi, at the end, sabi mo kanina ay may apply sa community ba? Or parang ganun eh. Hindi tayo binigyan ng pagkakataon mag face-to-face. Paano ang scenario natin? Hingi ka ba ng tulong kay Sir Gerard? Kasi nasa DOH siya. Ganon, papakita.
Ang iniisip ko kasi, Doc, yung in the future na pwede tayong hindi ko naisip yung sa current pandemic natin ngayon. So, parang, sorry po.
Pwede rin naman yung the future, parang ganon. Pero good thing na mention mo on that kasi majority ng na nag-present is only walang application on the application, kumbaga magdi-discuss lang sila. Pero sa'yo, i-apply ba? Tama ba?
Opo.
I-apply sa community. Sige, we're looking forward to that. Lagyan mo lang yung strategy on how it gonna work dun sa scenario. Sabihin mo lang kung kailangan mo ng tulong, natin yan. Sige. Thank you.
Thank you, Doc.
Next, Doktora.
Sir, sorry. Tumawag po kasi ang father-in-law ko eh. So, mute kanina. Saglit, sir, ha? Mag-share screen. Actually, sir, yung sa akin, medyo siya, similar siya kay Noel. Kasi, sir, hindi ko, di ba, sir, nung tinanong po kayo kanina, hindi ko po kasi na-gets, natatapusin na po pala lahat. Akala ko, yung parang pinaka...
Hindi, okay lang, Doktora, okay lang. Kung basta okay lang kahit bungi-bungi yan, no problem.
Nakikita nyo, ano pong makikita nyo, sir?
You have 11 slide nakikita dyan.
So yung PowerPoint na, sir, ang kita? Or,
yes, slide. Hindi pa naka-slideshow.
Okay, sir. Kasi baka yun. Teka, sir. Yeah. Teka lang, sir. Victoria. Teka, sir, hindi ko mapindot ang slideshow. How will I...
Sa lower. Sa lower right side.
Ito
lower right side.
Ito.
Yes, yan.
Kasi sir, natatakpan nung nung parang bar. Actually, kasi sir, yung sa akin, ang topic ko is actually yung to adhere to ethical, allied health professionals and legal standards, adhere to national and international code of conduct and legal standards that govern the profession. So sa akin, sir, medyo ano siya, talagang more of theoretical. Although, titingnan natin, sir, kung paano pwede. So, sir, doon sa pagkaintindi ko, which is mukhang mali, ang una na topic ko was for legal aspects and legislation in healthcare. So, medyo mas broad, siya yung broader topic na it will talk about the introduction of, to the overview of healthcare law. Tapos yung discover and discuss laws, regulatory mandates, yung healthcare policies and practices and meaningful consideration sa mga problematic and risk-related legal aspects of ethical, yung ganun, sir. So dito, sir, actually, ang pinaka-approach, once ituro theoretical, kasi, sir, pag sa mga legislation or law or yung mga policies, kailangan talaga i-discuss yun. Ngayon, sir, after nun, to check kung natutunan talaga siya ng mga estudyante is pwede siyang magkaroon ng mga case discussion kung saan pwede nilang i-apply or sasabihin nila, i-figure out nila kung anong law or policy or practices ang involved, tapos parang i-defend nila somewhat yung answer nila. So technically, sir, yun yung parang pinaka-application nung sa topic. Tapos, sir, so under naman dun, sir, so ito yung medyo mas specific na topics, which is yung history. Parati naman, sir, bibigyan ng history. Tapos, sir, yung government, existing government system, yung mga laws involved, kunwari in public health, and yung dapat na ethical practices, no? So, kasi, sir, meron tayong mga specific na health ethics, no? And according, sir, naman to CDC, it is actually important to discuss kasi yung tort law, which is yung sa negligence. So, kaya siya, sir, medyo may specific na parang bracket. Tapos dun, sir, yung mga, yan, sir. So, didiscuss din, sir, ang criminal aspects of healthcare, tapos dun, and so on and so forth. Dito kasi, sir, parang ang pinaka-objective nito is maging aware ang mga healthcare provider in the public health system na yung mga action nila, baka merong katapat na law na
Yes.
hindi siya inaalaw or hindi siya pala na ethical, no? So, kailangan talaga, sir, ituro. Tapos, ganun talaga, sir, yung kahit yung pag-mention ko kanina is i-apply kasi, sir, hindi naman to pwedeng hindi ka naman pwedeng pumasok pag may criminal case. So, more of application talaga, sir, the more cases to discuss, yung mga ganun, sir. So, tapos, sir, kasi sir, makikita niyo, sir, yung kanina, so talagang legislation. Tapos sir, yung mga code of conduct. So sir, sa code of conduct, nag-start ako sa World Medical Association na International Code of Medical Ethics. Ito, sir, parang kailangan lang siyang banggitin para malaman nila yung content hanggang, actually, sir, as we go on, magiging mas siya, specific. Tulad nito, sir, ang kasunod na niya is the Code of Ethics and Professional Conduct ng WHO naman po. Tapos dahil, sir, sa public health ay talaga namang involved ang research, so dapat, tingin ko, sir, importanteng i-discuss ang Code of Conduct for Responsible Research. Tapos ito yung Code of Ethics for Healthcare Quality Professionals and Code of Conduct. Tapos, sir, ito na, sa Philippines, so meron tayong Code of Ethics of the Philippine Medical Association and the PRC. Ito, sir, pag dito, yung i-discuss din dito yung iba't iba. Kunwari, sir, para sa doktor, para sa nurses, para sa yung para, sir, sa iba't iba pang healthcare professional. Teka, sir, ha? Ayan, sir. Tapos nun, teka, sir. Ayan. Tapos nun, sir, syempre, meron, wait lang, sir, wait lang po. Ingay, sir. Tapos ang sir, syempre meron tayo ng code of conduct na PhilHealth, which is importante. Kasi sir, tulad kahagabi, nabanggit sa amin, teka sir, ang ingay, sorry. Nabanggit sa amin na nung professor namin na importanteng mailagay na natin sa isipan ng mga Pilipino na in place actually sir ang universal healthcare system. So importante sir na alam natin din ang code of conduct ng PhilHealth. Tapos nun siyempre sir, sir, ito yung may joint kasi sir na yung Health Privacy Code of implementing pati yung Privacy Guidelines for the Implementation of the Philippine Health Information Exchange. Kasi sir, 'di ba, nilabas noong 2008, in-apply na ang yung data privacy rin sa atin. So kailangan din sir ma-orient ang actually sir kahit sino pang worker sa data privacy law. So with health, meron din naman po siyang specific on top of that. Tapos nun sir, syempre meron tayong specific na Public Health Code of Ethics na since ang magiging practice is in public health, so dapat aware tayo dito. And ayan. So yun ang last. So technically sir, since talagang puro theoretical siya, kailangan talagang iba to lahat ng laws, ng lahat ng guidelines, lahat ng code of conduct
Pero doktora, hindi masyadong detailed, parang by bullet lang.
Alin po, sir?
By bullet lang.
Opo,
yung
sir.
Discussion natin. Kasi baka hindi natin babasahin yung bawat
Ay, hindi sir.
Bawat law, lang.
Opo,
yung
hindi.
mga salient point.
Opo, sir. So parang meron lang mga babanggitin na parang mga sobrang important. Opo, sir. So, yun lang.
Yes.
Tapos sir, puro case discussion lang. Kunwari sir, pag na-discuss itong topic na to.
Yes, mas maganda nga yan. Case discussion.
Opo. So parang, kunwari sabihin ko lang yung pangalan nung kunwari sir nung law. Tapos pagkatapos sabihin kunwari yung mga law sir, magbibigay ng cases para ma-grasp ba natin sir kung tama tayo ng pagkakaintindi or tama tayo na magiging application doon sa mga natutunan.
Correct.
So, yun.
Maganda nga yan. Maganda yung mga different cases, no?
Okay. Kaya lang,
different cases nangyari sa Pilipinas.
Marami naman yan. Sir.
Alright.
Yun lang po. Sir.
Sige.
Yes, sir.
Alright. Meron pa ba? Balik ngayon
One more
tayo.
time, Doc.
Okay, sige.
Patry ulit ako.
Share screen. Yan. Pinicture naman na lang.
Ewan ko kasi bakit hindi gumagana naman siya dati sa PPT. Ewan ko anong problema ngayon. Nababasa niyo po ba?
Lakihan mo ba? Yan. Yan, okay na.
Okay, Doc. So, ito yung pagkakaintindi ko sa topic na utilize system-based approach to healthcare. Actually, hindi ko siya maintindihan kung ano yung gusto mong Doc. So, ito yung mga system-based approach in actual delivery of care. So, the course description, this course aims to discuss the different roles and responsibilities in patient safety. Actually, ito yung topic na to more on healthcare professionals na more on practicing kasi inadapt ko yung practice namin dito sa health center. So, tama po ba, Doc?
Sa safety lang to. Tama ba?
Patient safety lang.
Patient safety lang siya.
Yes, Doc.
Kasi marami siya.
Pero marami siyang...
marami kasi, di ba?
Marami na po kasi siya more on medication safety, access, prevention and culture of infection diseases, teamwork and communication, and recognition and response to incidents. So like for example, sa number 1 po, to ensure appropriate management of childhood chronic disease and medication in the school health program. So yung ito mostly sa mga school nurses po na naka-deploy. So meron din po silang system or training on how to manage this usually mga diabetic cases, and then meron pong referral system. So based on the incident report na nangyayari sa school, nagkakaroon ng system analysis.
Okay.
Then sa number 2, to implement an antimicrobial stewardship program that promotes the appropriate use of antimicrobials and reduces antibiotic resistance. So usually po, the misuse of antibiotics has contributed to the
Ano na lang
growing
natin, ma'am? Kumbaga yung utilize the system based on, burahin na lang natin yung umpisa. Kasi more on, yung dinidiscuss mo, more on the safety. Tama ba?
Yes po, more on the safety
Kasi
practices.
sa safety ka na lang, yun na lang ang topic mo, safety. Kasi sabi mo marami naman yun sa safety. Sige, science of safety.
Okay.
Okay,
So
discuss the science of safety.
okay. So
Okay ako
yun po.
dyan. Hindi patient, the science of safety na lang.
The science of safety?
Science of safety.
The science of safety, Doc, with regards to medication safety, access. Yun yung
Kasama yan
topic. Apo.
Kasi yan yung bago na ngayon, science of safety. Kasi tinuturo yan not only for the professionals but also dun nag-work sa hospital. For example, the security. Dapat turuan din sila ng science of safety. No? Halimbawa yung normally nabiprick, natutusok ay yung mga utility, di ba? Natutusok sila. Ay, tusok lang yan, parang barbecue stick. Pero yung tusok na yan, tusok ng karayom, pwede sila magkaroon ng sakit. No? Yun yung parang tinuturo sila, yung science of safety. Parang mas maganda yung topic mo. Tanggalin natin kasi very broad nga yung delivery care eh.
Yes, Doc.
Pero
Actually,
yung
ang daming
topic mo,
system
yung course
analysis,
description,
diba?
dito ka na lang focus ka na sa safety na lang. Sige. Alright, so okay, baguhin na natin yan. Kasi marami naman topic on the safety. Yung applicability on the public health. Not hindi lang basta dun sa hospital but also in the public health. Yung patient safety. Yung mga samples mo on the public health side.
Actually, kasi lahat po in-adapt ko from the practice inside the healthcare na talaga.
Okay, sige. Alright. Okay na ako dyan.
Okay, Doc. So babaguhin ko na lang siya more on patient safety.
Safety na lang.
Okay, Doc. Pero i-elaborate ko pa rin yung mga like, for example, medication side. Kasi meron pa kaming mga ibang patient safety like sa medication, reconciliation, mga ganun.
Pwede rin, oo.
O mag-focus lang sa isang topic, Doc. Ano ba? Kasi broad din kasi ito
Doon
mga
lang.
ano to eh.
Doon ka na lang sa ano. Basta yung katulad na sinasabi ko madalas, ano yung maitutulong mo sa classmate mo bilang isang public health administrator? Pag tinuro mo yan, magiging equipped sila tungkol dyan. Tapos may apply nila sa kanilang trabaho. Actually, yung science of safety, in-include ko yan sa MBA. MBA in Healthcare Management. Wala yung topic na yan eh. Pero in-include ko siya kasi pag hindi on top ang safety sa isang institution, like for example sa business, hindi on the top yung science of safety. Tapos nagka-demandahan, no? Dinimanda yung hospital because pabaya. Nagkasakit yung isang pasyente. Pag dinimanda, ubos yung ano nila eh, yung kita, di ba? Kung halimbawa ang kinita lang nila dun sa isang pasyente ay 100,000 for example. Pero merong rape sa likitor, lumabas yung for example infection related sa hospitalization, nagdemanda yung pasyente, 'di ba? Ngayon natalo ang hospital sa demanda. yung kinita nilang 100,000 for example, pambayad lang nila dun sa danyos. Something like that. Kaya palagi on top sa business, not only the business but other din, yung safety, science of safety.
Actually,
Okay,
Doc, with
okay.
regards to patient safety, bombarded na nga kami sa patient safety. Ang nangyayari lang is, ang kabaliktaran naman is wala ng staff safety.
Kaya nga kaya nga hindi patient science of safety.
Aha.
Science of
Kasi
safety.
dito, Doc, like for example, yung isang katrabaho namin na na-hit siya ng isang pasyente. So later on, sabi ng administration, it's up to you kung itutuloy mo yung demanda laban dyan sa pasyente. That is, laban mo na yan. Parang ganun. So, puro kami dito, patient safety. Pero walang
Kasi
staff safety.
pinapangalagaan kasi yung sa hospital
Mm-mm.
Pero paano kung public health, diba? Alright, sige. Next.
Doc, pwede ba ako? Kasi sorry, nasa work
JJ,
po ako.
yes. Yes, JJ, ikaw na.
Sorry po.
Ikaw na.
Pasensya na
Ikaw
po.
dapat yung una Okay na. Go ahead. Yan, naka-duty ka.
Wait. Sorry po.
Dapat ba kayo may magmas?
Ay, sorry, Doc. Kasi shared tong room. Kaya,
Lower.
okay.
Middle lower. Share screen. Ayan.
Ito po.
Middle.
Doc, bali, can you see my screen?
Yes.
Okay po. So, bali po yun sa akin is lead and manage healthcare team. So, yung topic ko po na na-choose is estimating workforce management of a public healthcare facility for department or nurse managers. So, the course would be a webinar course aims to teach public healthcare department managers in estimating, calculating, interpreting, and utilization of work management system. So ang mga topics po na inano ko is first is knowledgeable in regarding the hospital system, regarding hospital structure, services offered, budgeting and funding, and board of hierarchy. And all of this will be through a webinar series. Now, the next topic would be health professional and job impact. So knowing your workforce management, who are part of the team, understanding different healthcare professionals in the hospital, and basic knowledge of their job description. And then in the implementation, it could be also in webinar series and boarding orientation of the employees. So also there will be assessment like a case study. For topics, national and international health outcomes of public health. So the competency and goal-oriented for national and international health outcomes. So ano bang gustong health outcomes ng Philippines para ma-relate natin into our workforce management. And then the next topic would be international and local standards of statistical ratio to patient. So understanding of ideal ratio to worker to patient in optimizing health outcomes. Knowledgeable in terms of regarding the goals of the World Health Organization and DOH for appropriate ratio. So like 80 is to 10,000. Dapat 80 nurses for 10,000 80 nurses per 10 population po. So dapat alam din nung
One
department
nurses.
po. Dapat alam po nung nurse manager, department manager kung paano niya yung appropriate ratio based sa international and local standards. And also since na-discuss naman yung public outcomes po. So the last one is first. The next is the estimating, averaging, mean, trends, and understanding workforce structure. So more on statistics, kung paano mag-generate ng mga data, interpreting yung mga trends, calculation of workforce management. Also, We want also competency for the healthcare workers in estimating and predicting workforce based on needs and also future expansion. So dapat si department manager alam niya kung tama ba yung number of people niya, sobra ba siya, kulang ba siya, ilan yung dapat isobra niya for future expansion ng hospital or the services. And the last one would be the in utilizing healthcare management workforce system. As you all know, in terms of technology, meron na pong mga nauusong healthcare management workforce system. So kung saan i-enter mo lahat kung ilan sa department, ilan yung nasa servicean nyo. So pwede tayong mag-teach sa mga department health managers on also how to navigate those tools and also competency in generating and understanding those data. So ang implementation niya is also a webinar and in assessment of that, pwede silang ma-return demo sa atin and also a case study. Yun lang po, Doc.
JJ, at the end of this course, ano yung as a public health administrator, ano yung maituturo mo sa kanila dito sa class na to? Ano yung in-expect mong knowledge or competency na maibabahagi mo sa kanila?
Yung pag-manage po ng workforce management, yung pag-calculate po kung paano ma-estimate and also predict po yung workforce management na pinagtatrabahuan nilang public healthcare facility.
Ngayon, anong maidudulot ng pagtipid or needs ng mga workforce? Ano yung importante niya?
Yung yung importance niya po is syempre po sa yung health outcomes po. Syempre po kung better po yung ratio natin, syempre mas maganda yung health outcomes na ma-receive ng patients natin that we are working in the hospital. And also at the same time, yung for our healthcare workers, so syempre mas gaganda yung trabaho natin kasi mas focus tayo dun sa trabaho, mas mabibigay natin yung quality healthcare.
And of course, as a economic din ng
Yes,
hospital.
Po. Yes po.
Sige. Very specific pero kinakailangan malaman din ng mga bawat isa sa inyo, no? How to compute. May software ba ituturo dito?
Yes po, Doc. Pwede pong po. Yun po yung pinaka-last topic po. Kasi parang yung first 5 topics po is parang yung understanding principles, ganun po, yung paano mag-manually calculation. Tapos at the end po, yun po, mag-workforce management na system po. Paano, parang i-enter yung mga data, tapos pwede siya mag-generate ng mga trends, graphs, para mapabilis yung pagmamanage ng workforce po. Kasi po yung mga BPO, ang initially po, yung mga workforce management systems was created po sa mga outsourcing companies po. So, na yun po, may mga nabasa akong articles na parang pwede siya i-apply into healthcare structures para na mo-monitor nyo kung ilan yung services.
Alright, sige. Maraming salamat sa inyo. Labas po ating mga mukha. Picture tayo.
Doc, excuse lang po.
Yes, Noel.
Parang naguluhan ako dun sa akin kanina, yung comment niyo po. Parang hindi ko na masyado.
Yung sinabi ko. Kasi yun sa dulo ay you want to immerse them. Diba? Parang immerse. Yung strategy is to immerse the student. Yung may scenario or something. Sila.
Yeah.
Kailan ba gagawin mo?
At this time of paano nga po yun dahil pandemic, sabi
pandemic. Pero
example.
ano yung gusto mong gawin? Pwedeng webinar or may kakausapin, i-interviewin natin yung isang practitioner.
Pwede din pong po siguro mga kausapin or maggawa na lang ng scenario din.
Oo. Parang kay ano, 'di ba may mga case study, mga ganun. Pwede rin ganun, case study. Oo. Okay, sige. Any question pa?
Sir, bali po sir sa next meeting, i-discuss na po namin yung...
Yes, next meeting magdi-discuss na po. Unahan mo lang ako.
Sorry. Sorry. Oy, JJ, wag ka.
Okay.
Joke lang.
Dok, ang haba ng report, kumbaga. Parang haba ng sa akin. Ang
Oo
laki
nga.
ng...
Ayun talaga.
Yung sa ano, yung sa sino
Yung report, i-report ko, parang ang laki ng scope.
Hindi, wala na yung ethics sa'yo eh. Nasa akin na yun.
Kaya mo yan, Noel.
Oo. Susuportahan ka namin. Dito lang
Kaya mo yan.
Oo.
Alright, sige. With that, makikita pa tayo mamaya, 7 o'clock. Meron tayong 30 minutes para kumain. Maraming salamat sa inyong pagdalo.
Dok, maliliit lang po ako. May intubation po ako. Sorry po.
Huwag niya nang intubate.
Okay.
Sorry po.
Okay. Muna intubate.
po, pero nasa work pa rin po.
Victor, why is it like that? Because of my virtual background, I cannot listen. What will I do?
Iba yung damit mo. Ay, bakit ganun ano?
Bakit ganun?
Kailangan mo ng ilaw. Ilaw sa harapan.
Sa harap.
Against the light.
Hindi. Para akong multo.
Ano nangyari sa'yo, Dok?
Ako yung multo sa Hogwarts. Bakit ba? At least ano. Ako yung, di ba may mga multong naglalakad sa Hogwarts? Ayun. Wait lang, sir.
Snipping tayo, snipping.
Ay, bakit kanina okay na siya? Ay, sabi ko na mukha na.
1, 2, 3. Ayan.
Ano ba ito? Bakit yung mga bata marunong na yun? Bakit ako hindi ko magawa? Di ba, sir? Ayoko na nga.
Okay na po ba?
Teka lang. Okay na.
Ako na intubate. Mabubuhay niyo ba?
Okay.
Sayang na. Sayang tubo. Sayang
oxygen.
Alright. Salamat po sa inyo.
See you later, sir. Sir,
okay, see you.
Thank you po,
Ay,
sir.
teka lang. Wait. Ang una magpe-present si JJ sa ano? Ikaw ang una sa alphabet, ano? Tama. Ikaw una. Next Saturday.
Hindi matatapos.
Okay po, Doc.
Saturday.
Okay po.
Next Saturday,
Okay. Kala ko mamaya. So, nagulat.
Thank you. Maraming salamat sa
katagal ng isang tao?
Thank you po.
Mga ano lang, 1 hour lang siguro.
Oh,
1 hour each? Pwede 8 hours
ba?
kami,
So, parang mag-webinar talaga ako, Doc? Ganun po ba?
Hindi, dito tayo lang naman.
Oo nga po, pero parang mag-webinar nga po ako. Parang ganun po ba yung gagawin ko?
Para na siyang yung lecture. Pero,
nag-lecture ka?
ay,
Wala.
pa tayo, sir? Di ba, sir, last na tayo next week? Mag-extend ka, sir.
Last na ba?
Pwede naman, sir.
Last na ba? Last na? Di ba? Isang buwan lang ba?
Di ba, sir? Yung message kasi.
Isang buwan lang ako?
Pero pwede naman tayo, sir, mag-extend.
Pwede naman, Doc. Mag-extend ng isa pa.
4 na meeting lang ako? Talaga?
Miss nyo kami, sir.
Doc, may
Teka
thesis
lang,
pa.
hindi pa tayo
Mag-thesis
nag-umpisa pa lang tayo. Nag-umpisa pa lang.
Sir, pwede naman, sir, na kasi, sir, ano kami, next week. Kasi, sir, yung next month namin, ikaw lang, thesis 2. Kasi, sir, 3 sabay-sabay na subject ngayon. So, pwede ka naman din, sir, mag-extend till July.
Oo. Kasi hindi pa tayo nag-start. Wala pa tayo ano.
Tsaka, sir, hindi namin matatapos yung reporting na yan, sir.
Hindi matatapos yung reporting.
Oo, sir. Mahaba siya talaga. Sige. Sir, yung link parehas ng last time?
Hindi, mag-create ka ng bago.
Sige po. Okay, sir.
Okay, sige.
Salamat po.
Okay, sige, salamat. See you.
Thank you po, Doc.
Thank you, sir.
Thank you, thank you.